Media personality Robin Mbaba's Mulera, in her late 40s, began experiencing joint pains, skin rashes, and other issues.
I'm told this is iron.
Friends advised her to take supplements, reminding her that they become essential with age. However, instead of immediately following their advice, she chose to consult a doctor first.
And I was told that these supplements, if I just take them without the doctor's consent, I may exceed the amount of, say for example, either omega-3 or vitamin D, and then it will be harmful to my body. So that's why I went to hospital.
Tests revealed that her vitamin D levels were low, and her doctor prescribed supplements to address the deficiency.
I was told that if I take only for vitamin D, there are also other things that I may need. And I was told for the brain, because at times I had started forgetting. Then I also had too much stress, like as the anxiety was high, then I was also stressful, I think I was irritable.
Now in her second month of taking supplements, Mbabazi has noticed improvements. Her knees are no longer swollen and her skin has improved. However, she attributes these changes not only to supplements but also regular exercise.
Like my mood swings have reduced.
Despite the benefits, she sometimes worries about the potential for side effects such as liver damage.
Because now we take three tablets a day for 3 months. Then my liver may have issues.
Supplements come in various forms, including tablets, drinks, and energy bars. They also vary in type, from vitamins and minerals to herbal extracts, among others. However, health experts say supplements should not be seen as a substitute for food, but rather as a way to support individuals with specific nutritional needs.
First of all, a supplement is really a substance you take that gives you nutrients like vitamins, minerals, or herbal solutions in a sort of concentrated or isolated form to kind of bridge the gap between what you may need and what you don't really have, or in some circumstances something that you need that could help your body to work better or to improve your health or to reverse a disease.
Dr. Kasenen explains that ideally people should get all their nutrients from natural food sources. However, lifestyles, challenges in diet, and certain health conditions often lead to nutrient deficiencies that may require supplementation.
We live in a world where most people are going to need some kind of supplement because we live in a very stressful world. The way our food is grown and produced and prepared means that we are losing certain nutrients. Many people are struggling with health conditions, different factors like our age. We talked about the elderly, people who are pregnant or breastfeeding, people who are athletic, have many diverse nutrient needs. And so sometimes we're not able to get everything we need from our diet. And so supplements come in handy.
The point at which we advise our patients to take supplements are two. Either one who does not have access to the natural form of the nutrient, or someone who has medically been proven to have low levels of a particular nutrient. For example, old people, women in menopause tend to have very low levels of calcium, so they are encouraged to take capsules that contain calcium. The levels are significantly low. They are lower than what your body needs to function normally. So in that case, in addition to the food, you're also given a supplement because the supplement is going to give you the nutrient faster.
But for certain groups such as pregnant and breastfeeding women or individuals with chronic health conditions, those on medication, supplements should be taken following medical advice.
People who are on a prescription, especially a lifelong prescription, it is recommended that for any supplement that you're going to take, you need to first speak to a doctor. For someone who's going to have a surgery, it's recommended that you disclose any supplement you're taking to a healthcare provider, because some of these supplements might affect the bleeding. They might make you overbleed if you went for surgery.
While supplements are generally safe, excessive intake can cause side effects, although such cases are rare.
Well, first of all, you need to know what excess is, and that's why people need to be, well informed about these nutritional supplements, because If you take excess vitamin C, it can increase your risk for kidney stones. If you take excess iron, it can affect the way, if you are taking antibiotics, it can affect your risk for infections. If you take excess vitamin D, it can also affect your kidney. So yes, in very high doses, they can be risks. But most of the time, these are extremely high doses.
The only effect would come in if someone is taking a higher than normal dose. So if someone is taking an overdose, then they run the risk of either damaging the bones or damaging the kidney or damaging the liver, depending on the active ingredient contained in the supplement. But generally, we don't often see lifelong disadvantages from taking supplements.
Dr. Kasenene warns that not all supplements on the market are of high quality. Some manufacturers prioritize profits over effectiveness.
Other manufacturers don't take care to ensure that they have good raw materials or good quality products. Sometimes the ingredients are rancid or they've gone bad because the manufacturer didn't take into consideration that this nutrient is oxidized by heat or light and didn't take necessary precautions. So if you just buy over the counter, there is a chance that you could get side effects. One, because the quality of the supplement is not so great, but two, because you may take a dose that is not appropriate for you. Three, that it's interacting with a medication you're taking, it's interacting with the food that you're taking. And so you need to be careful with that.
For example, weight loss supplements are heavily marketed, but experts caution that their effectiveness is often exaggerated. NOBERT ATUKUNDA, NTV News.